To understand what is shoulder instability, we need to understand a little bit about the shoulder anatomy. So the shoulder is basically a ball and socket joint. The arm bone has the ball on top, which has to sit in a very shallow socket, which is a part of the shoulder blade. To support the ball in this shallow socket, to give it power, to give it flexibility, and to give it strength, it needs a lot of soft tissues to stabilize the shoulder. So these stabilizers are mainly responsible for providing support to the shoulder, and once these structures are damaged, then the shoulder becomes unstable. That means it tends to dislocate repeatedly. This is known as shoulder instability. So how do you know if your shoulder is unstable? Pretty simple. So you know that your ball and socket joint keeps coming out and going back in, sometimes on its own, but sometimes you might have to go to the nearest hospital to get the shoulder reduced again. And how do we treat it? The best treatment for shoulder instability, as per modern orthopedic science, is surgery. So there are two types of surgeries in the shoulder joint to treat instability. One is by arthroscopy and the second is by open surgery. Arthroscopy is when I put tiny 1 centimeter cuts around the shoulder joint, and then I put a camera inside the shoulder joint, which is almost the thickness of a small pencil, and then through these tiny incisions I will be able to repair the stabilizing structures of the shoulder. It provides the added advantage of a much smoother, less painful recovery after the surgery. Studies also say that the results of keyhole surgery are a little better and the recovery time is also a little quicker than the conventional open surgery. Despite this, some people need open surgery as well, especially when there is damage to the bony socket or the ball also, in addition to the soft tissue stabilizers. So during surgery, all the soft tissues are repaired, and if needed, the depth of the socket can also be increased. And surgical treatment is usually very effective. The results of shoulder stabilization surgery are excellent. In the vast majority of patients, they can go back to their normal life, whether it be activities of daily living like bathing, clothing, sleeping, without the risk of their shoulder dislocating and again. And even in high performance athletes, after a brief period of rest and rehabilitation, after the surgery, they can go back to their sports also.